In respiratory acidosis, the primary problem is PCO2 increase, then pH will decrease. After that, renal compensation happens, so bicarb increase in the same direction of PCO2. So let's see this example. pH is low, so acidosis. PCO2 high, so respiratory acidosis. Is there appropriate renal compensation? We will check. So PCO2 went up by 20. This is what happens acutely. So the bicarb should be 26. Actual bicarb of 27 is near to this, so it is acute respiratory acidosis. If the process persists 3 to 5 days, then it becomes chronic. In chronic respiratory acidosis, bicarb increases by 0.4. This should be the bicarb in chronic respiratory acidosis. Here is another example. pH is low, so acidosis. PCO2 high, so respiratory acidosis. We will check if renal compensation is appropriate. PCO2 went up by 18. Considering this is acute, bicarb should be 25.8. Actual bicarb is 35. So this is acute respiratory acidosis plus metabolic alkalosis as bicarb is high. So now the question is, what causes respiratory acidosis? CNS depressant medications, encephalitis, and brainstem disease are the CNS problems which can cause respiratory acidosis. Obstructive sleep apnea and lung disorders as shown. Chest wall disorder, kyphoscoliosis. It should be severe to give respiratory acidosis. Obesity hyperventilation syndrome, and also neuromuscular disorders as shown. How do you manage respiratory acidosis? By treating the cause. Acutely, patients might need non-invasive positive pressure ventilation or intubation and mechanical ventilation. Next, we will look at respiratory alkalosis. Here, first PCO2 goes down, then pH goes up, renal compensation happens, and bicarb goes down as well. Now we will look at an example. This guy has high pH, so alkalosis, low PCO2, so respiratory alkalosis. Is renal compensation appropriate? Is a question. PCO2 went down by 9. Acutely, if PCO2 decreases by 1, then bicarb decreases by 0.2. So bicarb should be around 22.2. Actual bicarb is 22. So this is appropriate compensation. So simple respiratory alkalosis. In chronic respiratory alkalosis, bicarb decreases by 0.4. So in this case, bicarb should be around 20.4. Now we will look at the symptoms of respiratory alkalosis, and these are some of the symptoms of respiratory alkalosis. Respiratory alkalosis also reduces cerebral blood flow and causes CNS symptoms like dizziness, mental confusion, syncope, and seizures. Respiratory alkalosis is rarely life-threatening, and common causes are CNS causes like pain, hyperventilation syndrome, anxiety, panic disorder, CVA, and CNS infections. Lung causes are pneumonia, pulmonary edema, PE, aspiration, and CHF. Treatment is treating the underlying disorder. Thank you very much for watching the video.